Should children with latent TB receive treatment? Imagine a child carrying a silent infection that could someday wake up and cause illness. That's what latent tuberculosis infection is, bacteria hiding in the body without causing symptoms. But should we treat these children to stop that from happening? The answer is generally yes. Medical guidelines recommend treating children with latent tuberculosis infection to prevent progression to active disease. This is especially important because young children, particularly those under 5, have developing immune systems that make them more likely to develop active tuberculosis if the bacteria become active. Treating early helps protect their health now and in the future. The good news is that treatment options are safe and effective for children. One common and preferred regimen is a 12-week course of once-weekly medication combining isoniazid and rifapentine. This short course is well tolerated even in children as young as 2 years old and has higher completion rates than longer treatments. For some children, especially where rifapentine is unavailable or not suitable, a 9-month daily course of isoniazid remains an option. There are also shorter alternatives, like for months of daily rifampin or 3 months of daily isoniazid and rifampin, which can be chosen based on the child's health, drug susceptibility, and ability to stick to the treatment. Deciding whether a child should receive treatment depends on several factors. These include the child's age, immune status, exposure risk, and whether they have other health conditions that might affect treatment. For example, children with weakened immune systems or recent exposure to infectious tuberculosis are prioritized for treatment. Sometimes, children who have recently been exposed but initially test negative may still receive preventive treatment until follow-up tests confirm their infection status. To help ensure children complete their treatment, healthcare providers often use directly observed therapy or closely monitor the child's medication intake. Routine lab tests are usually not needed unless the child has liver problems or is taking other medications that could affect the liver. In summary, current medical guidelines strongly support treating children with latent tuberculosis infection. Doing so helps prevent the development of active disease, reduces transmission, and protects the child's health long-term. The choice of treatment should always be tailored to each child's specific situation, with close medical supervision. If you have concerns about a child's health or possible tuberculosis exposure, it's best to consult a healthcare professional who can provide personalized advice based on the latest guidelines and the child's needs.